Is there a role for focal therapy using radiation therapeutic options?
I think he makes a very good point in that the majority of the times when you're doing the typical 12-core biopsy, it's really a random sample of the prostate, but it doesn't give the overall picture of what's going on in the rest of the prostate. So doing a focal therapy with the standard 12-core, we don't know what we're missing in those other cores. If we talk about mapping and doing the 30-40 cores that I know you do on occasion, and we have a better idea of how much cancer is really there and determine that it is just focal, then I think focal therapies can be, like you said, a good medium in that it may decrease the impact of quality of life, but still result in the ultimate goal of cure. And I just wanted to piggyback off of Elisa, what's your name?
Yeah, it's not Elisa.
Elisa.
But that's close.
Wow. Piggyback off of Elizabeth's answer on clinical trials in that it's not, you can't take him anywhere. It's not just one treatment's not working, we need to find the future of the next treatment, because in radiation for prostate cancer, where we're trying for cure, it's also about impact on life. And as well tolerated as it can be, and I'm going to speak about breast cancer as well as prostate cancer, the main problem is the time commitment that it takes 5 days a week between 6 and 9 weeks. So a couple of the clinical trials that we're doing right now is trying to find a way to do it in a shorter period of time. And we have preliminary data that says both are safe, but obviously we have to compare them against the standards to know that 10, 15 years down the road, they're just going to be as effective. So right now we're doing trials to treat breast cancer in 3 weeks instead of 6.5. And I just treated a man on clinical trial in 5 treatments for prostate cancer. So instead of the 40 to 44, we treated him over 2 weeks in 5 treatments. And again, it remains to be seen long term, but the good preliminary evidence is that it's just as safe. So that's another value of the clinical trial.